I've been coming here for 20 years, since I was 3 years old and diagnosed with acute lymphoblastic leukemia. It's a fast-growing white blood cell cancer that pretty much affects your entire body. When I was 3 years old till I was 6, I was in the hospital pretty much all the time getting my treatment. And then even after that, I had to come for weekly visits and monthly visits and yearly visits. I relapsed for the first time when I was a month before my 18th birthday.
I happened to be in clinic that day and kind of met Joey as he walked in, got him in a room, and we realized pretty quickly that this was not just a sick visit. I ended up calling his mom. I remember crying on the phone when I was telling her. I think people around me were crying.
That's when they decided chemo wasn't working. I needed a bone marrow transplant to eradicate my cancer. My 2 brothers were not matches for me, but all 3 of my sisters were perfect 10 out of 10 matches.
The procedure was, it wasn't like a bad recovery or anything. They took the needles and syringed my bone marrow out. We feel like we're closer now, and I feel really honored that I was able to do it for him.
Thomas, or Super Thomas, was diagnosed with acute lymphoblastic leukemia on October 23rd, 2016. So we're still in kind of the more intense part of his 3.5-year treatment. It was like a huge blow to our whole family. I remember coming up to the 4th floor and seeing all these nurses and Dr. Batla coming up and giving us a hug. Thomas is Joey's 2nd nephew. So they have a really special bond. I remember when Joey would be sick, I'd always bring the kids up, and they were like his therapy when we were in the hospital.
For Thomas, despite the sickness that he's going through, he just thought that his port made him like Uncle Joey, and so it didn't scare him. That is really unusual. This is not what you see with a 3 or a 4-year-old who's got a.l.l.
Getting to have, Joey to look up to has been really important for Thomas. I think it's helped him stay really calm and nothing really scares him. It's just, it is what it is.
The medicine's changed to the point where we can more tailor the therapy to the child's illness. For instance, if the child has certain characteristics that are measured now in the laboratory with genetics and things like that were not available 20 years ago, the treatment can be more tailored to their individual disease as opposed to the patient. It's rewarding, I have to say. I mean, I've gotten very, very close to this family where I actually see them outside the hospital, which is really nice. I've gotten close to their whole family, which is a large family. I consider them friends as well as patients.
Well, I wouldn't go anywhere else. I mean, we know everyone here. I mean, they're like family.
Coming to Glennon just makes the whole bad situation a little bit more comfortable. I know who's gonna see me. I trust the people who's gonna see me. It's just kind of like a big family up here.